Hey everybody, welcome to EMT Patient Assessment by Heathen Medic. We're going to be going through a multiple part series. This is part one, the scene size up. Okay, part one, the scene size up. The scene size up really matters. We do not want to become the second patient, okay? Don't forget the best EMT is useless if they become the next patient. You have to protect yourself, protect your team, and make sure everybody stays safe. So what exactly is a scene size up? It is a threat assessment and using your situational awareness. You have to protect yourself first. You have to identify hazards that may be there, understand what happened at the scene, figure out what's going on, use cues from the scenario, what's going on with you, okay? Determine priorities before actually make patient contact. Remember, the scene size up occurs before you even approach the scene. It's usually once you get the dispatch information and you and your partner are sitting in the rig saying, hey, this is what we're going to. What do we want to do? Okay. So remember, dead EMTs, we don't help anybody. So scene safety is always our first priority. It always comes first, okay? Things that can make the scene unsafe, such as traffic, weapons, unstable structures, electricity, aggressive bystanders, fire, and hazardous materials. These things can cause harm to ourselves and others. And if you're not specially trained to deal with this, if you're not a firefighter with your fire surgeon on your rig, on your truck for that, I'm not going to mess with a fire. Personally, I don't want to get burned. Okay, remember you can't help anybody if you need an ambulance for yourself. Next thing we look at, body substance isolation, PPE, BSI. These kind of go hand in hand with scene safety. Okay, we have to protect ourselves first. So things that you can do is gloves and eye pro. Gloves and eye pro is a minimum. Okay, that's a minimum of what you should be wearing when you're treating patients. BSI isn't optional because the patient looks clean. Don't forget that. You may need to put on a gown and mask as needed for different kind of situations. You may need to worry about bloodborne pathogens, contamination. But these are things to keep in mind and look for at the scene. If you notice any of these things and you cannot treat it yourself or you're not trained to do so, call for additional help. So the first thing we're looking at is BSI and scene safety. BSI is my scene safe. You're going to hear medics say that all the time as a joke. It's a saying, it works. BSI is my scene safe. Next thing we look at is the NOI versus the MOI, or the nature of the call. Okay, so what caused this to happen? Why are we here? Mechanism of injury. So these are usually trauma related, like a rollover multi-vehicle collision, okay? A fall, motor vehicle collision, a fall, a stabbing victim, blast injuries, anything that can physically hurt a patient. This is what MOI is, mechanism of injury, how they were injured, okay? Next thing we look at is the nature of illness. If there's no trauma, why are we there? Is the patient complaining of chest pain? Are they diabetic and forgot to take their insulin or took too much insulin? Are they having the facial droop and the stroke-like symptoms? Are they an overdose patient? These are things we need to look at and think about before we even get to the scene. What is the dispatch telling us about why we're here? Number of patients. Be sure to count your patients early, okay? Count them early and often. Make sure you don't get tunnel vision. Look for hidden patients. Look for pediatric patients. They will move around in the cabin of the vehicle before you can even get there. Patients that were ejected out of the vehicle. Multiple casualty awareness. Being aware of what's going on around you and how many patients you have is crucial. I have cats playing in the background. I apologize. One thing you look at is there's one motorcycle, but you see two helmets. Okay, what's going on? Were they wearing their helmets? Is it still on them? Etc. Be quiet. That was the cat not for you. Okay, don't worry. Something else you may look at. Additional resources. Make sure you call it early, but not late. A strong EMT will ask for help early. You may need an ALS intercept if it's something outside your scope of practice. You may need fire department, especially if you need a lift assist. Law enforcement for safety issues, air medical. Okay, if you're in a rural area and you have to travel 45 minutes, but the patient won't make it, you might want to call for air vac. Okay, as well as additional resources, additional ambulances as needed. What if there is a massive casualty, some mass casualty situation? There's a lot of patients and only two of you. You might need some more help. C-spine considerations. Protect the spine when it is appropriate. Not every patient needs a C-spine. And remember, C-spine consideration is only thinking about taking it right now. Potential of taking it right now. You don't have to take it yet, but it's possibly there, okay? So think about trauma indicators, what we're doing there, distracting injuries, altered mental status. If they're altered, they probably can't talk to you and tell you what happened. If there's a fall with or motor vehicle collisions, etc., things to look for. So C-spine consideration. I am considering C-spine or I am not. Okay? We're not taking it yet. That comes in the primary assessment. Okay, so it's common mistakes that students make. EMT students often they rush to the patient. Okay? They miss the hazards. They forget extra resources. They get tunnel vision. They ignore the scene cues or the clues. Okay? Look around the scene, figure out what's going on, take a breath, and figure out what you need to do. Okay? So scene size, and don't forget your snack. If you are a prior student and you have taken this course already or taken a course already, you know about your snacks. I love to eat snacks, obviously. I'm slapping my belly right now, just so you can tell. So things to look for. BSI, is my scene safe? My number of patients or my NOI, MOI is. My additional resources and my C-spine considerations. I put it in red here so you can see it. There's your snack. BSI, then your snack. So far, we're doing so well, okay? I'm proud of y'all. Okay, let's get into some practice questions. So many practice questions. Question 1. You arrive at a scene at a stabbing where a suspect is still nearby. What is your first priority? I'll give y'all a few seconds to think about that. Want to see a great painting my wife did of me at a painting event? Yeah, it's great, huh? Want to see what I did of her? I'm autistic, not artistic. Don't worry, she still loves me, I think. Okay, the answer is C, ensure scene safety. Okay, there's a cat in the background if you can't tell right here. Ensure scene safety. If you chose anything else, begin bleeding control. Potentially, if they're bleeding out, yeah, but that's not our first priority. The suspect is still nearby. We need to ensure the scene is safe before we enter because we don't want to get stabbed ourselves. I don't know about you, but I don't look good with a hole in my belly. Okay? And vital signs, that's not the way yet. I don't care about vital signs yet. Question 2. You arrive at a rollover MVC, motor vehicle collision, and notice 2 child car seats outside the vehicle, but only 1 child is visible. What should you suspect? A. The scene is secure. B. Additional patient may be present. C. Air medical is necessary. Or D. The second seat is unrelated. Do 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 do. Boo 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 boo. My lighting, I think it's terrible, but I'll work on that. Don't worry. Okay, the answer is B. Give yourself a round of applause. Yay! Good job if you got that. Okay, additional patient may be present. If there's 2 car seats, but only 1 patient you see, 1 child, look for a second child. Okay, as they say in The Mandalorian, where I want to see the child. Okay. Question 3. A diabetic patient is alert but covered in blood from a nearby assault victim. Oh no. What PPE consideration is most important? Okay, most important. Remove gloves for communication. BSI, PPE awareness despite medical complaint. Ignore contamination despite medical complaint. Or ignore contamination due to urgency. Focus on blood glucose. Okay, which one are we going to choose? If you chose B, you are correct. Woo! Okay, that was just a mini practice question. I'll do more of these throughout my lessons, don't worry. And for the final slide, the key takeaways. Make sure the scene safety comes first. The scene will tell you a story. Count your patients early and often and request additional resources as needed. Situational awareness matters. There's a saying in EMS, slow is smooth and smooth is fast. When you're practicing, you should be practicing slow until it becomes smooth. And then you work on your speed. Okay? Slow is smooth, smooth is fast. If you have any questions, thank you for joining us today. And be sure to follow me on my social medias and have a great day.